Teacher Fatien Ayunni, and today I would like to present about seizure disorder and epilepsy. Epilepsy is a neurological condition that causes unprovoked recurrent seizure. The seizure is a sudden rush of abnormal electrical activity in your brain. Doctor diagnosed epilepsy when you have 2 or more seizures with no other identifiable cause. What are the symptoms of epilepsy? Seizures are the main symptom of epilepsy. Symptoms may differ from person to person and according to the type of seizure. These can include a sudden feeling of fear or anxious, dizziness, change in vision, deja vu, or an out-of-body sensation. Two types of partial seizures, which is simple partial seizures and complex partial seizures. Simple partial seizures does not involve loss of consciousness. Symptoms include alteration to sense of taste, smell, sight, hearing, or touch, dizziness, tingling and twitching of the limbs. Meanwhile, complex partial seizures involve loss of awareness or consciousness. Symptoms like staring blankly, unresponsiveness, performing repetitive movement. Epilepsy. There are so many causes for epilepsy, such as traumatic brain injury or other head trauma, brain tumor or cyst, serious illness or very high fever, brain scarring after brain injury, post-traumatic epilepsy, stroke, which causes about half of epilepsy cases in older adults when there's no identifiable cause, according to the CDC. How is epilepsy diagnosed? Use CBC, complete blood count, and chemistry of your blood. Blood tests may be used to look for sign of infection diseases, liver and kidney function, blood glucose level. Electroencephalogram (EEG) is the most common test used to diagnose epilepsy. Is a non-invasive and painless tests that involve placing electrodes on your scalp to search for abnormal pattern in your brain's electrical activity. You may be asked to perform a specific task during the test. In some cases, the test is performed while you sleep. Imaging tests can also reveal tumors and their abnormalities that can cause seizures. These tests might include CT scan, MRI, positron emission tomography (PET). Epilepsy is usually diagnosed if you have seizure, but there's no apparent or reversible others. To prevent seizure, in many instances, a seizure is not preventable, but maintaining a healthy lifestyle can give you the best chance at reducing your risk. You can do the following by don't take illegal substances, get plenty of sleep, eat a balanced diet and drink plenty of fluids, exercise regularly, and engage in stress reducing technique.